This is Hot Topics from the American Acne and Rosacea Society. Topical treatment of acne often involves the use of more than one drug. In fact, several fixed-dose combination topical treatments are available on the market. But can a new multi-combination product be used in combination with other topicals? That's what AARS Treasurer Dr. Emmy Graber sought to determine through a pilot study recently published in the Journal of Clinical and Aesthetic Dermatology. She assessed the safety, tolerability, and efficacy of a triple combination gel containing clindamycin, adapalene, and benzoyl peroxide used concurrently with clascoterone cream. She spoke with us about the study, which
was actually done at my office, so I'm very familiar with it. This was a prospective pilot evaluation looking at the combination of two topicals that we currently have available for our use for treating acne, and looking at when they're used in combination in adult patients with acne, how they do. So the two topicals that were studied here were clascoterone cream, which patients applied BID in the study, and the newer triple combination product, clindamycin, adapalene, and benzoyl peroxide gel, which was applied at nighttime in these patients. So this was a very small study, and it was just really an initial pilot study or pilot evaluation to see if these products used in combination were safe and also if there was any efficacy here. So we enrolled 7 patients in this study. 6 patients completed the study. The study lasted up until 8 weeks. There were follow-up periods at baseline, 2 weeks, 4 weeks, and 8 weeks into the study. As I mentioned earlier, all of the patients in this study were adults, and the average age in this study was 23. Most of the patients were females. To enroll in this study, they had to have mild or moderate acne as graded on the IGA score. So what we looked at primarily here was the inflammatory lesion counts and how they reduced from baseline up through week 8. We did find that there was a significant reduction in inflammatory lesion counts at week 4. So this is really exciting. And we also found that for the study, using these products in combination, it was safe. There were no major side effects. There was some minimal stinging, burning, erythema, but importantly, self-reported adherence rates were over 90%. So patients were very compliant with this. And that alone tells me that it was tolerated really, really well. So patients were instructed, I'm going to back up just a little bit. I mentioned this earlier, but patients were using the triple combination product, the clindamycin, benzoyl peroxide, adapalene gel at nighttime. On top of it at nighttime, they were applying the clascoterone cream. And in the morning, they were using just clascoterone cream. All the patients were using a standardized gentle cleanser and standardized gentle moisturizer with sunscreen if they would need it as needed. And patients, as I said, tolerated it very well. They did better. We did not capture non-inflammatory lesion count reduction, or we did not capture IGA scores at each follow-up period just for enrollment at baseline, but the inflammatory lesion count was reduced significantly as early as week 4. So this is a small study, and certainly we need more larger studies looking at using this combination together for treating acne. But what importantly we found here was that in this pilot evaluation, it was safe. There was nothing really serious that happened to any of these patients, and it seemed that they got better. So I got the idea to do this study for 2 reasons. One, we know that with a lot of products that contain benzoyl peroxide or topical retinoids, one of the common side effects is dryness or irritation. I found in my clinical practice that using clascoterone cream, it had a really nice thick formulation that patients found very tolerable. And I started using these in combination with my patients because I felt that the two complemented one another. And I was seeing really good results in my experience. So I thought, well, let's study this in combination. And the other reason I wanted to study these two medications together was a little bit theoretical. When we think about the pathophysiology of acne, we know that there are four main steps in the pathophysiology: hyperkeratinization, production of sebum, inflammation, and the presence of the bacteria C. acnes. So if we have topical medications that can combat all four steps, in my mind, we're probably going to get the best or the most optimal results. And so with utilizing these two topical products, we can attack or combat all four steps in the pathogenesis of acne. So early indicators from this small study are really good that these can be used in combination. We need to do larger studies looking at these medications in combination. We need to have a longer follow-up period to make sure that it's safe. But I think this is a positive sign that these may be useful, and this might be something that perhaps more of my colleagues will consider doing clinically.
Dr. Graber says she was surprised by one finding and highlights a key lesson from the study.
One thing that was unexpected about this study was the excellent adherence rate. 93% of patients were adherent to this treatment protocol of using these two topical agents together. And we know with our acne patients, compliance is key. And here we can give them two topical products that contain 4 active ingredients, rather than getting 4 individual products alone. So compliance was great with these 2 products. So that's helpful for our patient success. It also, again, speaks to the tolerability of the product, because if it weren't tolerable, people wouldn't be using it. And so this was unexpected, but a really pleasant surprise. With the results of this pilot study, clinicians can maybe start to consider using more topical medications in combination. They may be doing this already, but it's something that I think clinicians should really think about: the mechanism of action of acne and what they're choosing for topicals. And are these topicals combating different steps in acne pathogenesis? Because I believe if we are combating different steps, as many steps as possible, we are going to get the best results.
We appreciate Dr. Graber's participation in Hot Topics from the AARS, and thank you for joining us. The Hot Topics from AARS podcast is a complement to the semi-monthly Hot Topics newsletter. The Hot Topics newsletter is an AARS member benefit delivered to your email inbox. Get information at acneandrosacea.org.